Okay, so now I want to talk to you a little bit about Medicare Advantage plans. What are Medicare Advantage plans? Medicare Advantage plans are programs where, and here's how they were born. I'll tell you how they were born. The Medicare supplemental plans started getting a little expensive for people, for a lot of people, and pricing people out. So the insurance companies basically went to Medicare and petitioned Medicare and said, let us behave as Medicare. We want to now be Medicare. We're going to administer Medicare for anybody who elects to sign up with us. We will behave as Medicare. And Medicare said, okay, as long as your plans are as good as, if not better, than original Medicare. And they got very creative in these programs. And many of them, the ones that I like, typically include the drug plans. And they add some extra benefits. You know, some add dental, some add some vision, some add hearing aids. They usually add silver sneakers or a membership to a gym. You'll see a variety of different things that are added. However, they still have to work with this framework that I've already described on previous videos. Usually, these plans have a lower premium. Some of them have a $0 premium in many markets. So this is kind of important to understand. As I said, supplemental, the ones that I like, are pretty robust plans. You're going to pay a higher premium for that, and you're going to have robust hospital and medical coverage. These plans typically come with a lower, some as I said are $0 premiums, and they include the drugs, which the supplements don't. And you have some copays. So what they've done is they're still working within this framework, except that they've reassigned everything. So, you know, here, if you're in the hospital and Medicare pays everything except for $1,408 for the first 60 days, these plans reassign that. Usually, and there's so many different programs out there, the ones that I see assign a per day value to this, so that maybe your plan says you have to pay $350 a day for days 1 through 5. So if you're in the hospital for one day, you have to pay $350 for that day. If you're there 2 days, you'll pay it twice. If you're there 5 days, you'll pay it 5 times. Okay, if you're only there one day, it makes life a little easier. If you're there 5 days, you know, you're going to pay a little bit more there. However, sometimes this is more attractive. And they have out-of-pocket maximums on these plans. So there are stop-loss gates for, you know, financial gates, let's say. Typically, they're $6,700 in network and $10,000 out of network. Those are, I think, the Medicare maximums. I've seen some lower. I've not seen any higher. So this reassignment, after you're there for 5 days, if you're there longer, you pay $0, and you have unlimited days in the hospital. So they allow you to stay in the hospital as long as necessary for a $0 copay after you pay the first 5 days. This is how they work this out. This is how they can do it for 0 or for very low premiums. In addition, the $144.60 a month that you're paying to Part B is going to these companies through Medicare. They have contracts with the federal government. How do they work out the 20%? That Part B, that you must pay on Part B? Well, first thing they do is most of them, not all of them, eliminate the $198 deductible. It's kind of interesting. On the 20%, let's say you go to your doctor visit, for a doctor visit, you're going to have a copay. You know, some plans, you're going to have a $5 copay. Some it's going to be $15. Maybe some it's $25. They vary. I'm not talking about any specific plan. I'm just trying to give you a general synopsis of how these plans work. If you go for a specialist, your copay is probably going to be higher. It may be $35. It may be, you know, $70. It depends upon the plan that you have. They vary. And this is why, you know, you should use somebody who really knows what they're doing, who really cares about people, to help you find the right program. One of the other reasons that you should use somebody else is because many of these plans are HMOs, where you know, health maintenance organizations, where you must use doctors within a certain network, unless it's an emergency or urgent, of course. And on that basis, what happens is, you know, if you go out of the network, they won't cover it. Some plans are PPOs, where you can go in the network or out of the network. At any rate, I'll go deeper into that in another video. What we have here, if you have other services, right? So what are your copays? The 20%, well, maybe if you have outpatient surgery, instead of having to pay 20% yourself, maybe you pay $325. I realize I'm running out of space here. Maybe you pay $325 for that outpatient surgery. These are important things that you need to know. What if I go to a chiropractor? What if I go to a therapist? What if I go for outpatient surgery? What if I have, a some sort of observation stay? What are those services going to cost me? What if I have testing, an MRI, a PET scan, a CAT scan? Some plans have a $100 fixed copay for that. Some plans, you pay the 20%. Some of the downsides to these plans are the networks and other things like this skilled nursing. Some plans cover some of this. The Medicare Advantage plans cover the $176 a day. Some of them don't. Some cover portions of it. So what I do is when I'm looking at your program, trying to find the right, all plans don't treat your drugs the same. This is one of the reasons that we do this work. Once we know which drug plan within the Medicare Advantage plan will treat your drugs the bestly, then we look at your doctors. Are you rigid? Do you need to keep your doctors? Is it critical to keep your doctors? That is the case in many times. Then we look at what doctors take that plan. And if we get the merging of those two items, that program, in my opinion, becomes a serious consideration for you. I know I gave you a lot. I'm going to go into more detail, trying to keep these